Dr. Haines, thank you so much for joining us today. Always great to have your insight on these topics.
Nice to see you as always.
So, I want to start with just the basics on this. Can you explain how exactly diet impacts our body regarding inflammation and ultimately, potentially, back pain?
Yeah, diet's critical. I mean, it's the way we fuel our bodies. I used to think back when I was young and probably a little less smart that I could just work out my way through everything. So I've always been very good about, or pretty good about staying routine about my exercises, but I was neglecting the input part. I was neglecting my diet. As I age, as I get a little bit smarter, as I read more, it's definitely true. It's what you power your body with. If you have a car, you need to give it gasoline to power. It doesn't matter how awesome that car is. Without the proper fuel, it's not going to perform well.
hmm So let's talk about the common foods that people might not realize are actually causing that back pain. What are some of the things that we need, the pitfalls we need to watch for? What do we stay away from?
Yeah. So first in generalities, one of the analogy I think of is that when it comes to the body's level of inflammation, it's not oftentimes that bad diet per se causes back pain, but our body's ability to tolerate back pain diminishes. So I always this visual of a pitcher of water. So by example, if you have a bad back and you have a couple discs that are degenerative, well, that may add a couple glasses of water to the cup. But then you don't sleep very well, that may add another glass of water to the pitcher. And then, eat a high inflammatory diet that may add a couple more glasses. Next thing you know, that pitcher overflows. If you're able to eliminate a cup or two, that can decrease it to that point that you're not overflowing anymore and that your body can tolerate the conditions that you may have even better.
Okay, so that's a great analogy, and we can actually picture that. It's like a bank, you either take or you give.
Mhm.
Um, what? How is it that these foods, and I want to get to specific foods, like what are the specific foods, but how do they cause inflammation in the body?
So certain foods, sugary foods in generalities, think sugary foods and think processed foods. Those tend to be the things with a lot of additives that make our body very inflammatory, very constantly kind of fighting itself in a sense. That gets down to the crux of what inflammation is. Inflammation is your body being just too amped up. Now, inflammation can be a good thing. By example, if I were to have an infection, I want my body to fight that infection and it does so with some inflammation. But when it's chronically irritated, that's when it's in a suboptimal spot. One of the ways, by example, directly to your question about sugar, about processed foods, well, they're not natural, right? Even though there is some natural component to them, our body's not supposed to be constantly ingesting them. It makes it very hard on the GI tract to actually do the physical absorption of it, which can cause some inflammation. But then once it's in your bloodstream, because your body doesn't want it to be there, it can attack it and almost in this inflammatory cascade per se.
So it's like the body is not used to, or is not accustomed. Well, is not able to process these foods that are potentially toxic, and that triggers an immune response. Is that basically what happens here?
Yeah, that's a pretty good summary.
Okay, so then how does the inflammation impact back pain? How does that cause the back pain?
Well, so one of the major causes of pain is inflammation. Now, if you have a disc herniation per se, an injured spot in your back, well, that causes a localized inflammation over that area. But if you're already fighting that and we're flooding the body with a whole lot more inflammation, it's this 1 + 1 = 2 phenomenon where you feel it even more.
Okay, but I'm curious how does it cause back pain? Why does the back hurt because
Mhm.
of more inflammation in the body?
In general, if someone has zero back pain and or zero back damage, typically an inflammatory diet, high levels of inflammation in the body, usually are not going to cause that to be symptomatic. But it's only when we have this sort of subsymptomatic level of irritation, inflammation in our body in an injured area like the back, which is so common, that once we add on that additional level of inflammation from the diet, from lack of sleep, from stress, or what have you, that's when it tips the scales in the favor of unfortunately hurting.
Okay, so let's talk about those specific foods. You're talking about sugary foods over processed foods. I'm what? Give me some specifics so people have these, like specific takeaways and can avoid those foods.
Yeah. So I'm definitely not throwing stones here because I like these pretty much all the foods that I'm about to mention. But
All in moderation,
yeah,
right?
it's all in moderation. There was one time my wife told me she was like, "Let's go, no gluten today." And by the end of the day, I had to get some Doritos. Right? I couldn't even do it myself after less than 24 hours. So a lot of the foods that frankly I really like bar food, pub food, like chicken tenders, pizza, hot dogs, a
Mhm.
lot of that bar food, spinach artichoke dip. Basically, these are all my favorites. Those are things that are really processed and they're not good for you. So, fried foods, French fries is another example. A lot of fast food or even a lot of fast casual food is not so hot for you. So, you know, lots of bread, lots of sub sandwiches. Those are all things that tend to be more inflammatory.
Trans fats, refined carbohydrates, things like white bread and pastries, fried products, and even red and processed meats like deli meats, right?
Yeah, one of the ones that oftentimes people don't think about is actually potatoes. So people think of French fries because there's a fried component, but what gets boils down to the science behind it all is the faster the sugar hits our bloodstream, the
Mm,
more inflammatory oftentimes it is. So things where, without getting into the weeds too much, complex carbohydrates. Well, what does that mean? The complex means it's hard for our body to break down, but that's actually a good thing because if our GI tract only slowly breaks down that carbohydrate, it means the absorption into our bloodstream is actually slower. So that's why complex carbohydrates, you hear that term all the time, that's better for you than a white bread. The
mm.
reason being, white bread, why it's a simple carbohydrate, is because our GI tract can digest it very quickly, meaning it's a quick hit of sugar to our bloodstream. And the same thing with potatoes, quick hit of sugar to the bloodstream.
And again, going back to your original analogy of, the water pitcher or the bank, it doesn't mean you can't have this,
Correct.
but just not all the time, or you pay the consequences.
Yeah, I had. I shouldn't be admitting this out loud, but I had a Italian sub for lunch. Right, not ideal, but I had I had oatmeal with almost no processed food this morning. Right, so it's this counterbalance, and it's both doing it sustainably because it's a diet. I'd rather someone cheat every so often if it results in long term success, other than as opposed to going on a crash diet and having those wax and waning episodes.
Well, and on the other side, there are anti-inflammatory foods. So balancing them out with, something that really is working to help your body. Talk about those anti-inflammatory foods and how they help reduce the back pain.
Yeah. Well, one of them is actually water. The more water you drink, the more we tend to flush out that inflammation. It's almost, I tend to think of water a little bit of as a cleanser. It dilutes everything in our body. So
Mhm.
by diluting some of that inflammation out, that's one way that being properly hydrated can be extremely beneficial for you. Some
Mhm.
of the other ones, one of the common ones we think of, turmeric. It's a wonderful spice that is used in a lot of cooking. I know a lot of patients who take turmeric supplements. Fish oil is a little bit mixed. For a while, fish oil was kind of the best supplement that most people thought of. There is actually a little bit of recent data showing it may not be as beneficial for you.
Mm.
So something to definitely consult with your healthcare provider about if fish oil is still a benefit to a person in particular.
Okay, but fruits and vegetables, I know berries. I mean, I'm an avid blueberry eater.
Yeah, blueberries are wonderful. Yeah, so the berries tend to be pretty darn good. Oftentimes, what I do, I put bananas in my oatmeal. That's a common breakfast I eat. It's better. I just like the flavor of bananas more. But if I were trying to minimize inflammation, I wanted to supplement the oatmeal with some sugary berry, raspberries, blackberries, blueberries, strawberries. Even not quite as good, but all of those are better low inflammatory berries, fruits in general than a banana. The
Leafy,
berries family tends to be pretty good.
yeah, and leafy greens, and I've heard tomatoes too are also anti-inflammatory.
Yeah, one saying I like is "eat the rainbow." Right, so if you can eat the natural rainbow is probably a better way to put it because all
Mhm.
the packaging is now green just for marketing purposes. But yeah, eat the rainbow with leafy greens. I love spinach. That's kind of my go-to. Sometimes I'll make smoothies where I'll put kale in it. I don't love the flavor of kale myself, so I tend to eat more salads with leafy greens, like spinach. But big fan of broccoli. Throw in some carrots, but and the berries as well.
Yeah, yeah. Eat the rainbow. Plus, your plate looks a lot prettier too, right?
It's all about aesthetics, right?
What are some of the biggest dietary mistakes you see so many patients, Dr. Haynes, that you see your patients, the mistakes that they make?
I made a joke about this earlier, but I think marketing is something that has really hurt our people in our society in general when it comes to nutrition.
Hmm.
Everything is green, right? I have, at my house, I've got veggie straws, right? My kids eat them all the time. In a way, I'm able to trick myself that it's health food. It's not. It's a maybe slightly better version of a chip, but it's still a fried chip, kind of.
Hmm.
So a lot of the things that I caution people look out for are the packaging. When you look on the ingredients, if it's got one of those laundry lists of different ingredients, it doesn't mean you have to look at each individual one. But in general, when that list is long, you may not actually be wanting to have that because it may be much more processed food that's pro inflammatory.
Well, and I've even heard that if you just look for the oils to see what I mean, like you said, all these names are so long, but a seed oil can be an indication of something that is not good for your body and could promote inflammation, like canola oil and sunflower oil, things like that. Is that what you understand too?
Yeah, canola is a classic one, right? It's wonderful in baking, but that tends to be much worse than I like olive oil a lot. Unfortunately, I like that flavor, but that's a much healthier oil from an inflammatory as well as a heart and cardiac perspective as well.
Mm-hmm. Okay. Talk to the people who are uh, actively, and are work out all the time, and how important it is to balance your physical activity with the diet that supports your spine health. Are there particular foods, if you're more active, that you should be eating, or are you just saying this is the same across the board for anybody?
Yeah, I mean the principles in general are about the same, but when we think about if we're actively training, oftentimes we're either training to maintain or training to build. Kind of depends on what phase we are in life.
Hmm.
That's what nutrition is. It's the building blocks upon which our body builds.
Hmm.
So, especially when we look at actually some of the studies, when we look at simple stuff like caloric requirements, it makes sense. Like if we are actively training, our bodies need more to continue to actually replenish what we're beating up a bit. By example, if I'm not eating at all and I'm training like crazy, first I'll lose a little bit of sugar in my bloodstream. Then what follows is the fat, but actually you lose muscle too. So unless we're doing the proper nutritionalization, we're hurting the cells that our body's actually wanting to bulk up.
That makes sense. That makes sense. Okay, so you mentioned the water before, that's an important part of an anti-inflammatory, diet. Why is water so important for your discs and for reducing back pain? And then let's talk about some of the liquids that may not be so good, like alcohol and caffeine in your coffee. Let's first talk about the water. Why is that so important for a healthy back?
About 80% of the discs in our back, which are the shock absorbers of the spine, is actually water. Now it's a little more complicated. It's not just like a water balloon that's sitting in between the bones in our back. What it actually deals with is it deals with the underlying biochemistry of our discs. So the water molecules stick to basically love to adhere to a healthy biochemistry in our disc.
Hmm.
As we age, we lose that proper biochemistry chemical makeup of our discs, and the water tends to follow out. So it's not that by drinking a lot of water we can really rehydrate the discs, but if we're choosing between the two being dehydrated or appropriately hydrated, it may tip that scale in favor of some maintenance of the health of those discs long term.
That makes sense. And would you recommend adding an electrolyte to water so that the body can absorb it a little bit better, or where are you on that one?
So electrolytes are fantastic. I mean, so essentially what happens if you drink only water, if all I did was drink water and I didn't supplement with any salt, that actually is pretty hard on the body. We need to, again, it gets a little complex, but basically water can dilute the normal electrolytes our bodies have. If we dilute those electrolytes, that can affect water balance, and actually that can cause headaches, can cause dizziness, can cause issues in the brain, but also issues in the muscles. We really need to replenish water and salt in the appropriate ratio. Good
Hmm.
news is most of the time, especially in the modern diets we have, we do get more than enough salt in a regular diet. But if you're doing like a hard run, a long marathon, something where you're really sweating, you
Yeah,
actually don't want to just drink water. You want to drink water plus electrolytes.
yeah.
Gatorade, that's why it was first, created was for that. You'll see tennis players who are burning calories like crazy have one of those little gel supplements. It's because water alone would actually be suboptimal for them.
Interesting. Okay, so let's go on the other side of the equation to the more dehydrating drinks. You say alcohol, always in moderation, but how does that impact us?
So you mentioned one of them. I mean, if we're being honest about alcohol, it's a poison on our body. It's a poison that we like as a society, and it's socially acceptable within moderation. But it does dehydrate you. I mean, so in that, most people know if they drink more, they tend to urinate more. It has this tendency to dehydrate us based on the way it interacts in the kidney. The other phenomenon is alcohol. Some of its breakdown products are actually a little bit poisonous. Now, our body can tolerate that and can clear it out, but there's no doubt about it. I mean, especially now that people are wearing, the different rings and the wristwatches that allow us to really track a lot of our health metrics. I was talking to friend after friend who say, you know what, I had some drinks last night. Look at my sleep; it was terrible, and I didn't even realize it. I have a friend who's basically doing a dry summer. His sleep has never been better, and he's actually gained tangible metrics to help that out. So his sleep
Mhm.
is better, his heart health is better, and there are a lot of other factors that, reality is alcohol is not ideal. Everything in moderation, though.
Yeah. So when you feel it in your back, think about what you're putting in your body.
We got to fuel our bodies with the appropriate nutrients and supplements to allow us to continue to progress and live life the way we want to.
Uh, Do you recommend certain dietary habits to your patients in terms of like, obviously you mentioned earlier a balanced diet, but if somebody is doing a certain, a fast or what are the things that you suggest in terms of long-term habits for your patients?
It's very individualized. I think it starts with me getting to know that person extremely well. There are times that intermittent fasting is a wonderful way to lose weight, but not everyone needs to do intermittent fasting because if you don't need to lose weight, that may not be the strategy for you. I'm a big fan of viewing this as a marathon. It's not a sprint, it's a marathon. It has to be sustainable. Going back to my little joke about, me getting hangry and eating Doritos, if for me, a no gluten diet just really wouldn't factor in unless I gained much more self control. And I know that I don't think I have to be zero gluten. Could I pull back on it a little bit to minimize my inflammation? Well, yes, and that's what I've been able to do. But looking at long term habits where it's okay to have a cheat day, it's okay to have a dessert. We don't need to be too stringent with it because if everything's rule based, what's the fun in life? So we have to be able to enjoy our diet, but we got to be smart about it as well.
Yeah, yeah. It is so individualized, and it's yeah. If you restrict for too long, there's bound to be a rebound. Before we wrap, I just want to get your thoughts on nutrition overall for the spine. How do we approach this in our mind in terms of supporting our overall health, and how important that is for our back health? Like what I think for a lot of people, if you don't have a bad back, if your back isn't hurting you, no big deal. You're not thinking about it. But when your back starts talking to you, that's when you really need to
Mhm.
pay attention to your diet. So, what are some good takeaways for our audience today on really how to approach this issue?
Yeah, good overall health is good spine health. So the more healthy our overall body is, the more healthy our back is. Now, directly to your point, we don't really think about our back when it doesn't bother us, right? So the important part, and I've noticed this with myself, maintenance is everything. I used to have periodic back pain flares before I was much more diligent about my specific core exercises, as well as being eating a lower inflammatory diet. And I just haven't had a back pain flare in years. Now,
Mm.
my flares are never terrible. I've been very fortunate in that respect. But my back would talk to me a week to two out of a year, and it's been 6, 7 years since I've even noticed my back in the negative. I'm a firm believer of the more you focus on diet and exercise when you feel good, the more you'll just continue to feel good. And I've been kind of proofs in the pudding with me.
Yeah, yeah. Creating those habits early and thinking about the fact that you are what you eat, and maybe it's a good DIY exercise. How are you changing your diet to help yourself at home before we have to come and see you?
It's way easier and better if you can prevent something than have to treat it on the back end.
Right, right. All right, Dr. Colin Haines, as always, we appreciate your insight. Very, very helpful, and sending us off on a good, healthy tangent with back health and anti-inflammatory foods.
Thank you, Laura.
Thank you.